Well, everyone, my name is Rick Freeman. I'm with a company named Interopian. You may know us from a different name, iSolid Solutions and MedAppTech. We merged earlier in the year to form Interopian. We did that because of how quickly the Smart on FHIR ecosystem is starting to take off. I think both of our companies were very committed to seeing it get going. And so let's see if I can figure out how to use this clicker. All right, this one. There we go. So a little bit about us. Both of us started in 2012, and what you would know iSolid for is that we built the Smart on FHIR reference implementation, as well as a number of smart applications that you're familiar with have been taken in production. MedAppTech, Nikolai N.Schwertner was one of the co-inventors of Smart and Smart on FHIR, and obviously built a lot of the applications that you all know and love and have seen so many different times before. We'll talk about those. We to this day continue to host and had built previously the HSPC Sandbox and Gallery and Developers Portal. We also host and built the Smart Developers Sandbox that you'll see out there. As well as we're working currently on a new platform product that we're not ready to talk too much about, but we're really excited, Interopio. It's really going to unlock the power of Smart on FHIR and what it's truly capable of, and allow you to move beyond the current constraints that your EHR has on what you can do. And I know that every project that we go into to help with these health systems, real quickly, we start to find out what we can and we can't do, given the current release of Smart on FHIR with the EHR vendors, and Interopio will greatly increase what their capabilities are. And then you know us for our BP centiles and patient risk factors and consent forms. We're going to show some of those today. But you're also probably seen the bilirubin risk chart, the pediatric growth chart, and the cardiac risk factors applications that you see basically all over the web. We wrote those, and we've taken those into production at any number of different places. So we're really excited to come together. We believe that there's no greater consolidation of knowledge and know-how when it comes to Smart on FHIR. And as a result, we have some very exciting ongoing projects with Intermountain Healthcare and Merck Pharmaceuticals, Duke, Boston Children's, Wake Forest, Harvard, University of Utah. The list really goes on and on. But what I really wanted to do is just take this opportunity to announce that this has happened. So iSolid Solutions no longer exists. Neither does MedAppTech, that Interopian is here, and we've got a whole suite of applications. Today we're just going to show you a couple of them, and we've got many more to come here in the near future. So, Nikolai? Okay.
All right. Thank you, Rick. Okay, folks, I'm Nikolai N.Schwertner, and today I'd like to show you two of our newer applications. So the first application that I'd like to show you is the medical risk calculators. Some of you might have seen the cardiac risk application, which was essentially one of probably the first Smart on FHIR application that we put together. But the thing about the cardiac risk application was that it was a sort of a one-trick pony. So we thought, wow, what can we make better than the cardiac risk application? We wanted to create a platform which was extensible and could essentially represent any medical calculator out there. And we came up with the medical risks calculators. So this is our answer to that challenge. So the medical risk calculators helps improve patient adherence and help manage risk. It also serves as an interactive patient education tool, which enables you to have a meaningful conversation with your patients. And has a number of nice features. However, I'm going to jump straight into a live demo. And we're going to find out if I am foolish or smart, but so we'll see. Okay. All right. So risk calculators. I'm going to authorize the application. You're familiar with the HSPC sandbox, right? Okay, there we go. So my sample patient has loaded, and on this screen here, I can actually see the data which we managed to pull out of the EHR. And some of the data is kind of dated, so that's why it's highlighted in red. I can tweak it if I'd like. I can add additional data. So that's where I do it. And based on the data that we get from DHR, these are the calculators which are applicable, which we have data for. The first one is the cardiovascular risk calculator. We can play what-if scenarios with the patient to have a conversation with him. Hey, Joe, well, look, you've got kind of high risk for cardiac disease. However, if we could manage to bring down your blood pressure just a tad, and then maybe if you quit smoking, well, look, your risk actually is now much lower. So take diet, do some exercise, take your medications, and live long. We have a stroke risk calculator which follows a similar format. The stroke risk in diabetics calculator does not have sufficient data at the moment. We have a lung cancer risk calculator. I don't have any data for this patient for lung cancer, so I'm just going to add some data by tweaking the sliders left and right. And one thing which we decided to do experimentally with this particular calculator is instead of displaying the actual risk score, which is something like would be 0.0 some % per year, which doesn't seem high, but it does compound over the years. Instead, what we decided to present is a new metric, which is the multiple of how much higher your risk of lung cancer would be over an average person, which we thought was a little more impactful here. And then we have a lung age calculator. I'm actually going to switch to centimeters from inches. Okay, there we go. So the lung age calculator calculates how many years younger or older your lungs look like based on your respiratory volume. And we have a number of nifty features in the application we can print out and so forth. So it's a fully developed medical calculators tool. Okay, so back to the presentation. I actually put some backup slides in here just in case. The pediatric forms application. So this application enables you to automatically collect data straight from your patients while they're in the waiting room or even while they're at home. So our hope is that by this application will help improve efficiency at the clinical practice. And also, this application is based on standardized forms by the American Academy of Pediatrics. So it should also bring the benefit of standardization of the forms that you are giving your patients. So it has a number of great features, such as a seamless handoff to a tablet. We can use a QR code, or we can actually send an email to the patient. The clinician has full control over the forms which are to be delivered to the patient. The form's data is automatically validated and then stored with the EHR. And the application takes care of guiding the patient through the forms completion process. Also, the application has a localization feature where we can actually deliver the forms in any number of languages. Okay. There we go. Okay. Okay. How am I doing on time? A couple more minutes? Okay, fantastic. All right, so I just launched the forms application as a clinician, and I have now access to all the patients that I have access to. I am going to set up a new patient encounter here. So, okay, we're going to pick patient Yuanda Warren. We can choose the language in which we want the forms to be delivered. I'm going to stick with English for now, but we could do Spanish just as well, and then the application can be extended with other languages. The forms which the application recommends, based on the patient age and demographics, happen to be those 3 forms. I'm going to pick those, but we do support the complete set of AAP forms out there. I think I'm going to stick with those 3 forms. or maybe, how about another one? Okay, and then we create the request. The application generates a QR code, which we can snap with tablet, and then that will load the questionnaires directly on the tablet, or we can send an email to the patient, and then the patient can follow through with the link in the email. Or the patient can walk into a patient portal and then launch the application and complete right there. Lots of choices about how to go about it. So here I'm just going to simulate clicking, snapping actually, rather the QR code. And that loads the patient interaction component of the application. And here we have the questionnaires with the patient, which the patient has to complete. So I'm actually probably won't have time to click through everything, so I'll just click a couple of things. Here is the next questionnaire that we've got for the patient. And here is another one, and so forth. So the patient basically moves from questionnaire to questionnaire to questionnaire, and we can see progress as the patient is moving along. At any time, if the workflow in the practice necessitates that, we may decide to, instead of saving the data in the EHR, or maybe we don't have an EHR which is able to, where we actually can write the data in FHIR into, there is a print feature right here on the screen, and it is going to generate a PDF of the form with the answers complete, and we can just send it to the printer. And then patient clicks submit. Fortunately, right now I cannot submit because I haven't really done the work of completing the forms. And then that is going to, we'll be able to see the results in the management tool, the patient management tool. Okay, so these are the two applications that I want to show you today. So thank you for your time, and I hope that we can get invited again to show you some more of our work.
Other ones. Yep.
Yeah.